Hey everybody, Jim Prusak here from the Pain PT, and we're going to talk today about acceptance of chronic pain and how we really only have two choices that we can make with our chronic pain or chronic health symptoms. We can either choose to accept them or we can refuse them. And I'm going to show you what happens when you start to accept your symptoms and accept your condition versus refusing it or not accepting it. So, acceptance, what is acceptance? Well, if you look at the words on the page here, you can see a couple different things. It's an allowance, ability to be present, to sit, to be in agreement, to be free, to be at peace, to be in the flow, to understand, to accept, open, acknowledge, appreciate, release, stay calm, let, breathe. So, all these words, if we can take these words and bring them to our feelings, which are essentially our physical symptoms and emotions in the body, we give our systems a chance to heal. So, I'm going to show you why this works and why we should choose acceptance of our symptoms versus non acceptance or refusing our symptoms, which is basically resisting them or reacting to them. And the reason why we should accept their symptoms is because the whole issue with a mind body syndrome and with most chronic pain is that it's a signaling issue in the brain and nervous system. It's not a structural issue in the body like we see with acute pain. And because it's this signaling issue, the way that we get out of it is to change the signals in the brain that travel through the nervous system. We want to turn on messages of safety and messages that we're okay. So when we bring acceptance to what we're feeling in our bodies, whether it be symptoms or emotions, we're actually turning on that safety system. We're turning on that part of the nervous system that causes our bodies to relax. That's the healing part of the nervous system. The other thing I'll say about this is that this is not a serious issue. This is just a signaling issue. It's very benign. Your system is intact, the nerves are intact, the messages are actually getting through quite clearly. They're just the wrong messages. And so we're trying to change this messaging in the system. And acceptance is one of the big ways that we do that. One of my favorite poets and writers of the time is Rumi. And this saying here makes a lot of sense. The cure for pain is in the pain. And so, what I take from this and what has helped me tremendously and other patients as well is actually going into the pain, going into the symptoms with acceptance and noticing what's there. There's nothing to be afraid of. Remember, this is not a structural, serious, dangerous, or threatening problem. It's just a signaling problem in the brain and nervous system. So, because it's safe and it's not dangerous, we can go into the pain, we can go into our symptoms and feel them openly with acceptance. And that's what allows things to change. The first step to change is accepting your reality right now, honoring your process. Compassionate self awareness leads to change. Harsh self criticism only holds the pattern in place, creating a stubborn and defensive basic self. Be gentle with yourself as you would with a child. Be gentle but firm. Give yourself the space to grow. I love this quote because it really brings to light a few things: acceptance, compassion, self awareness, and being gentle with ourselves. And also gentle but firm. So we need to let our nervous system know and our brain know that we're okay. Sometimes we have to be firm and say, no, I'm fine. I'm going to do this activity. You're not going to stop me. We also need to be compassionate with loving acceptance and gentle with our bodies and just allow our bodies to express these feelings, which are symptoms and emotions, openly with acceptance because it's okay. That's how we heal our nervous system. So, when we talk about accepting your feelings, again, I'm mentioning both symptoms and emotions or anything you actually feel in your body. So there's two choices here. There's only two choices, really. You can either accept your symptoms and emotions or you don't accept them. And now these correlate very well with the nervous system as well. There's only two pathways in your autonomic nervous system. One is the sympathetic fight, flight, or freeze nervous system on the right side, and the other one is the rest and digest parasympathetic nervous system, which you see on the left side. So acceptance actually activates that parasympathetic healing rest and digest system, where not accepting activates the very system we're trying to turn off, that fight, flight, or freeze nervous system. So when you open to accepting both your symptoms and emotions, which are your feelings, you're embracing these things. We have this saying where you embrace to erase. When you openly feel your feelings, you let them be expressed. This allows for change. And when we accept something, we consider it no longer a problem, which is exactly what this mind-body syndrome is. It's not a problem at all. There's nothing actually wrong. So whatever we feel is okay to feel. When we do this, when we start to accept and openly feel, the feelings naturally subside in time. And this allows us to improve our affect tolerance, which is our ability to feel uncomfortable feelings in the body. And we realize that all these feelings are really benign. There's nothing actually dangerous or threatening about them. Now, if we take the other side of the coin, this sort of fight, flight, freeze response, and by the way, this is an automatic response that you already have right now in your system. Anybody with chronic pain or chronic symptoms is automatically going to get this non-acceptance response, this fight, flight, or freeze reactive response, which is resistance or reaction. So when we resist, these things persist. Symptoms persist when we resist them. We don't get a change in any of our feelings or symptoms or emotions when we don't accept them. We have a tendency to react to our feelings negatively with negative thoughts and behaviors. This keeps the feelings stuck in place. And when we try to fix these feelings, we try to fix our symptoms or fix our emotions because we don't like them, that also keeps them stuck. That also activates this fight, flight, or freeze part of your nervous system. And the whole point here is not to fix anything because there isn't anything to fix. It's just a signaling issue. So we need to change the signals going through the system from negative to positive and feel what we feel in our bodies instead of avoiding feelings. And a lot of times when we don't accept what our body's giving us, we're actually suppressing and repressing these things. And this is what Dr. Sarno talks about in his books about suppressing and repressing emotions, emotional feelings. This just makes it worse. And we start to think that feelings are dangerous when in fact they're just benign. So I'm going to end up here with a little quote from Eckhart Tolle, one of my favorite authors of The Power of Now and a couple other books. He says, accept, then act. Whatever the present moment contains, accept it as if you had chosen it. This will miraculously transform your whole life. This has been true for me and true for others. When you can accept what the present moment gives you right now with what your body is giving you and accept it as if you had chosen it, this can change yourself. This will cause a transformation. It's the acceptance that causes the change. It's the acceptance that leads to the healing. Not trying to fix it because there's nothing to fix. We're trying to fix it. That's a form of non-acceptance, resistance, and reaction. So what's happening right now in your body? What do you feel right now? Can you accept this moment? Can you accept the situation you're in? Can you accept your symptoms? Can you accept the emotional feelings that go along with your symptoms? It's all about acceptance. This is the practice of loving acceptance, radical acceptance, deep acceptance. And this changes the signaling, again, in the nervous system from the brain into your body. It's very powerful. It's an approach that heals a lot of people. If you have questions, reach out to me. Give this a practice. And it's a practice you do on a daily basis, not just once or twice, but it's each moment that arises that you're resisting or reacting to or not wanting to accept. It's the parts of yourself that you're not wanting to accept that you want to bring the acceptance to. And this means feeling what's there, feeling uncomfortable sensations, uncomfortable emotions, anything that arises because it's okay. It's benign. All right, everybody, have a wonderful day, and we will talk to you soon. Bye bye.